study has on unmarried fathers' support has progressed. Unmarried parents and those who serve them brought us concerns about the way the system itself is creating the barriers to unmarried father involvement. One aspect of this is some significant confusion about what it means to be a legal father. There is confusion both within our study and within the participants about what it means to be an involved father. The service providers and the parents told us of their frustrations, so we looked more closely. And the first step was to understand a significant policy governing unmarried fatherhood, which is the issue of a legal father. When a child is born to unmarried parents, they are asked to sign an acknowledgement of paternity form. That's a federal policy. And that makes the unmarried father the legal father. And signing this form must occur before an unmarried parent is allowed to put the father's name on the child's birth certificate. This father then becomes the legal father. However, this does not give the father any rights to legal custody. We commonly think about that as decision-making about school, religion, and medical. And it does not give the father any rights to physical custody, parenting time, holiday time, or any of those things. Moms and dads frequently believed, however, that when the father signed the birth certificate and the mother agreed to have the father sign the birth certificate, that the father got some parental rights. One dad said, "I was proud. I was like, man, this is my son. This is a legal document that's going to be with him forever, his birth certificate. Like, this was a real powerful piece for me right there. I was really proud until I found out what it really means, that it's just a joke." And that stuck with us.
So there's nothing that goes with it? Can you visit your son or daughter if they're sick in the hospital? If you're the legal father, are there any rights that go with it at all?
Chair Gordon, there are not. What you can do is you can request to go to court to request rights from a judge.
So with those questions in mind, we did some interviews with unmarried mothers, unmarried fathers, and institutional experts to learn more about their experiences and perceptions of these policies and of these barriers for father involvement. So for our interviews with unmarried parents, we use community engagement-minded strategies to meet participants in the community at times and locations that were convenient to them and make our interviews as successful as possible. What we really learned from this engagement process above and beyond our findings that we'll share in a minute is that this issue was of really large importance to many unmarried mothers and fathers in Minneapolis that we worked with and interviewed. Parents had a very strong desire to speak with us and share their experiences and engage with us around this topic. So we typically ask parents for about 45 minutes to discuss these themes with them. And it was not uncommon to have interviews lasting over an hour as parents had stories that they wanted to share with us. We allowed parents to refer other parents who they thought would be a good fit for the study. And we ended up with a wait list of parents who wanted to participate and, again, share those experiences with us. Ultimately, the interviews that we were conducting covered personal topics, sometimes intimate, sometimes challenging topics for unmarried parents. But parents were ultimately very interested and willing to share their experiences with us and to have their voices heard. Sometimes interviews would get emotional, and at the end we had parents who thanked us for spending the time to hear their stories. I had one father after an interview who stopped me and gave me a hug and just said, "Thank you for hearing my stories," as some fathers and mothers had felt that they hadn't really been heard before. So we wanted just to share that with you, just to say that there's a tremendous amount of interest around this topic among unmarried mothers and fathers in Minneapolis. So with these strategies in mind, we came to our interviews with some general questions, but we really let parents drive the conversations based on what they felt was most important to them and most relevant to their experiences. So these are a couple of the policies that we went in talking about, but we did, again, let parents drive the interviews.
Our analysis is very preliminary at this stage, but there are some clear themes that are emerging, and we want to share these with you. One is that current family support systems exclude unmarried fathers. Some of this is language, such as what institutional experts and parents told us, that within social service systems, family actually means mom and baby. Or when people say parents, they really mean moms. Some of it's delivery, not talking to dad even though he's in the room, or making dad wait in the lobby when the appointment is solely focused on mom. Some of it's not offering any services to dad, period. Some of it is a situation like one institutional expert who works as an advocate for fathers. And he told us a story about going into a family justice center and how mom and dad sit on opposite sides. And on mom's side were all the county workers, all the official supporters, and there was not a single supporter on dad's side. And he said it was intimidating to him as an advocate and his coworker to walk in as the only person to support dad, much less the dads themselves. One dad told us, "I felt like I was going against an army, and I was just one." Another clearly emerging theme is the idea that stereotypes of unmarried fathers are pervasive and that parents are painfully aware of these stereotypes. They're aware of the assumptions regarding deadbeat dads, and the biggest issue is that policies are built on them and push dad out of the picture. Parents report that they're aware of them. When their child's born, they're less concerned with weighing systems and policies and more interested in their child, which is typical. But the idea that these assumptions create systems and policies was something they also reflected on, looking back on that time of, again, pregnancy and the birth of their child. And what the unmarried moms and dads we interviewed told us was more about dads wanting very much to be involved with their children.
So we now want to spend just a little bit of time and highlight some of the voices from the mothers and fathers that we interviewed around one specific topic that we started talking about a little bit before, which is unmarried parents' experiences with putting the father's name on the birth certificate. As we mentioned, unmarried parents are given the option to complete a form in the hospital after their child is born, and this establishes the biological father as the legal father, and then this is the prerequisite for putting the father's name on the birth certificate. So we wanted to share some of what parents told us around this moment in particular, because we think it really speaks to how parents are approaching their views of father involvement as their child is born and as their child is starting out their life. One of the questions that we asked all of the parents was what sort of things they thought about when they were deciding whether or not they wanted to put the father's name on the birth certificate. And we actually had about half of the parents we interviewed tell us that it wasn't really a decision that they were making by weighing pros and cons or advantages or disadvantages, but rather, as they described it, it was a given. So, for example, one father said, "That was automatic. I'm going to be on their birth certificate because I am their father, and it's my responsibility, and I don't take that lightly." So for many of the parents that we interviewed, the desire to put the father's name on the birth certificate was really about their sense of responsibility or their commitment to their child or their desire to be involved. Many parents connected this with a sense of symbolism that they got from the birth certificate and emotional benefits for the father, the mother, and the child. So starting with the father, many of the fathers that we spoke to said that they saw the birth certificate as an opportunity to show their commitment to their child and show that to other people that they were committed to staying engaged. So one father said, "I don't want to be considered deadbeat. I've got to leave some type of trail like dad tried, you know. I did what I could to the best of my abilities. I never forgot about you guys. I take care of my responsibilities." Other fathers felt that the birth certificate allowed them the opportunity to be recognized for their role as a father and as a parent to the child. So one mother, speaking about the father of her child, said, "He was happy that he could finally be recognized and take that stand, as I am the father. At first, all the attention is on me and baby, but with this, he was able to be involved and be recognized as the father." Unmarried mothers also spoke to the symbolism of the birth certificate for themselves, saying that they felt the birth certificate was an opportunity to see that the father was committed, and it made them feel more secure, knowing that they had a co-parent who was going to be there with them. So one mother said, "I think another benefit for the mother is just feeling that when you sign a birth certificate, you're signing this partnership, that you're accepting this as your child. This is my child, and we know together that we can do this." The most frequent category of the symbolism that the parents talked about was the symbolism for the child, thinking about the best interests of the child and looking forward. Some parents, thinking about their own experiences growing up, told us that they did not have their own father's name on the birth certificate, and so therefore they wanted to be sure to have the father's name on their own child's birth certificate. Other parents looked forward and thought about when their kid was grown and maybe applying for a job or going off to college and seeing their father's name on the birth certificate and the symbolism associated with that. So one father says, "Suppose your kid is a pro football player and goes to Yale College or Harvard, and you're going to feel great about that because you're on the birth certificate saying, 'That's my son.'" So we wanted to share this particular moment in time because we really think it speaks to the father's strong desires to stay involved and both the father and the mother actually desire to have the father involved in the life of the child. What we learned through this process is that desire is really strong, especially at birth, and then over time, the parents identified barriers for us that made it harder for the fathers to stay involved. We are going to continue our analysis, but the health department is really committed to continuing this work focusing on unmarried fathers and father involvement as an important component of health in Minneapolis. So with that said, our next steps are to complete the analysis of our interviews and really deep dive into the barriers that the unmarried fathers and mothers already identified for us. And then we want to take this information back to the community and share it with them because there was such excitement around this topic and so much interest from our community partners and the parents that we spoke with. And then get possible solutions and recommendations from those same parents and others in the community about what could be done to work with some of the barriers that the parents identified for us. And so with that, we thank you for your time, and we're happy to answer questions.
Well, thank you very much. I appreciate it. And I hope that you'll come back if you have some policy recommendations. I have to say that I think there would be probably judges and state legislators who would be interested in exploring ways so that right at this time of the birth of a child, when fathers and mothers are kind of cooperating and declaring, that they're the parents, that if they knew there were a couple more steps that they could take so that they could have some rights and maybe more responsibilities to go along with it, it could really be advantageous. So appreciate this. And you still have grant funding left to continue the research a little bit longer?
Chair Gordon, yes, we are continuing the data collection and enrollment of participations for our larger study. This has completed this portion of the study on specifically honing in on barriers to father involvement.
Okay, excellent. I don't see any other questions or comments. I can't really take any action at this time, however, because we lost a quorum. So I might wait a minute and we'll make a motion in a little bit. Well, actually, I think I can make the motion now. I'll just move to, unless Councilmember Fry has any questions or comments. Okay, I'll move to receive and file the presentation. All those in favor say aye. Aye. Any opposed say no. All right, that motion carries. And then the last item today is a climate change project presentation, and this is receiving and filing a presentation on the results of a vulnerability assessment. And I believe Ms. Blix is going to come and make a presentation with her team. Welcome.
All right, which one do I hit?
Slideshow. That's what I ought to try.
Thank you, Mr. Chair. I'm Pam Blix. I'm the Preparedness Manager for the Health Department. Today, our team includes Kelly Millman from the Coordinator's Office and the Sustainability Office, and also Jenny Lansing from the Health Department. In 2012, the Minnesota Health Department identified extreme heat, thunderstorms, and severe rain events as top priorities in terms of planning for preparedness in our department. And I think we all identify with the extreme rain events of the last month that we know that we've had an increased number of them. To address those concerns, the health department applied for and received a small grant to assess our vulnerability for climate change and to address that in the city. We're here today to share some of that information with you, and because we're starting the next phase of the project that will potentially involve some of your constituents, and we wanted you to be aware that we are going to be working in the community on this project so that you're up to speed on it. The project capitalizes on previous climate change vulnerability and adaptation work in the city, and it helps to educate and engage the community around climate change risks. It will also help us achieve goals to help make the most vulnerable and disproportionately affected populations more resilient to climate change in the future. Some of the primary work of the project to achieve our goals in the 3 phases includes analyzing the City of Minneapolis's vulnerability to extreme heat and flooding as a result of climate change in Phase 1, engaging disproportionately affected residents of the City of Minneapolis in conversations in their neighborhoods around climate change resilience in Phase 2, and then 3, finally in Phase 3, advancing the city's key employees' understanding of climate change impacts and the community concerns as it relates to our work.
Good afternoon, Chair, Council members. I'm Kelly Molman from the City Coordinator's Office, Sustainability Office.
Good afternoon.
So I'm going to talk about the first phase of the project, which was the vulnerability assessment. As Pam mentioned, we have data from the state, region, and local level that show that extreme heat and changes in precipitation are 2 of the greatest threats that Minneapolis and the whole state of Minnesota are facing as a result of climate change. So to analyze these risks, we partnered with urban planning students at the University of Minnesota Humphrey School of Public Affairs. Last fall, we met with city staff, and we've also met with researchers from the University of Minnesota to identify and obtain the most appropriate data for the analysis. The students created maps with the data in an attempt to better understand the idea of place vulnerability. So not just sort of what trends are happening, but where specifically are these issues happening within the city. Really focusing on the components of vulnerability to heat, vulnerability to flooding, and then also a component of social vulnerability. So not is it about the location of where the risks are, but how much more susceptible would you be if those incidents were to happen. So for social vulnerability, we mapped populations that are inherently more vulnerable. We mapped cumulative social vulnerability. For heat, we mapped the urban heat island effect, and as well as identified opportunity areas where there's high impervious surface and low vegetation levels. And then for flooding, we looked at a number of different factors that contribute to flooding, including low elevation, as well as some of the same factors that increase heat risk, such as high impervious surface levels and low levels of vegetation. So now I'm going to show a couple examples of the results. So for social vulnerability, we worked with the students to identify 9 critical indicators of social vulnerability to climate change. They include poverty, race, homeownership status, disability, English proficiency, access to a vehicle, access to air conditioning, and age. The first step was to map each measure individually, and the small maps that you see here show the spatial distribution of each of the 9 indicators. The color goes from dark blue as the low vulnerability to dark orange as the highest vulnerability. So then we combined the values for each of the indicators into a combined social vulnerability map, which you see on the right.
So you said no access to air conditioning, and then on the graph it says no central air conditioning?
Chair, that is correct. So central air conditioning is tracked by our assessor's office. So that was where we got the data for that. We don't have data for whether people have window units or wall units, and we also don't know necessarily whether they're using air conditioning even if they have it. So that is one limitation to the data analysis.
Right, thank you.
So for place vulnerability to heat, one of the variables we looked at was urban heat island, as I mentioned. So this data was provided by the University of Minnesota researchers. This map illustrates the average urban heat island effect in degrees Fahrenheit over June, July, and August of 2012, one of our warmest summers in recent history. So this data shows that in general, Minneapolis was 3 to 4 degrees hotter than the rural baseline area. And this effect is actually even worse on extreme heat days, as well as particular evening and overnight hours of those very hot days. So this data, with this data, we know that Minneapolis is truly the urban heat island core of the metro area. Other variables we looked at for place vulnerability to heat were the degree of vegetation and impervious surface across the city. So these two measures overlap to a great extent. So meaning where you find high impervious surface levels, you're going to find lower levels of vegetation. So the map on the left illustrates the overall landscape vulnerability to heat, meaning low vegetation cover and more impervious surface at a 30-meter grid level. And then the map on the right shows the results averaged by census tract so that we could compare those to some of the social vulnerability factors. So as with the social maps, the places that have the highest landscape vulnerability to heat are in the dark orange, and the places with the lowest vulnerability are blue.
Chair Gordon and council members, I'm Jenny Lansing, and Senior Environmental Research Analyst with the Health Department, and I'll be talking about phases 2 and 3 of this project. After the completion of the vulnerability assessment, project staff identified 3 communities to focus our upcoming community outreach efforts. We selected Longfellow, Near North, and Phillips communities. From there, we identified two community partnering organizations within each of the 3 communities. These community partners will work with us as we move forward with the community outreach. On September 12th, we will hold a workshop for our 6 community partners. At the workshop, we will have presenters from the Minnesota Pollution Control Agency, as well as the Minnesota Department of Health, talking about climate change, health effects of climate change, and issues surrounding resiliency to climate change. City of Minneapolis staff will lead a training on the community outreach that will take place in the fall of 2016. In addition, there will be collaboration opportunities for the different community partner organizations. The community outreach will consist of an evening or weekend dialogue event that will take place in each of the 3 communities. Community partners will be responsible for recruiting 15 to 20 resident participants in each of the dialogue events. At each of the dialogue events, dinner will be served, and each participant will receive a monetary stipend for their participation in the dialogue event. The dialogues will be co-led by city project staff and the community partners. At the dialogue, community members will be led in discussions focusing on the effects of climate change. These are effects such as increased heat events, increased flooding, and increased risk of severe weather. In colder weather, we're looking at an increase in freeze-thaw cycles, which will have effects on housing and infrastructure. And in warmer months, we're looking at effects such as increased pollen and increased air pollution. The discussions will focus on areas that communities already have resources in place to be resilient to these effects and areas where more resources are needed. The final phase is phase 3. Phase 3 will consist of a project evaluation that will be completed with support from Macalester College. There will also be a final report produced that summarized what was learned from the 3 community dialogue events. This will culminate with a presentation of the report to the project stakeholders, including community partners, resident participants, and city leaders. City project staff will make recommendations for areas where resources are needed to make Minneapolis more resilient to the effects of climate change. At this time, we can take any questions unless you have follow-up.
I'll ask a question, and maybe this was obvious, but why did you choose those 3 communities for the last phase?
We chose those 3 communities after evaluation of the vulnerability assessment, looking at the areas that were most vulnerable to the effects of climate change.
Okay. Councilmember Johnson.
Thank you, Mr. Chair. I just wanted to thank you all for the very interesting presentation. In particular, I liked the way that you used data to come up with the social vulnerability and just some of the ideas, including seeing the urban heat island, which will generate follow-up. In fact, I just sent colleagues an idea around white roofs and parking lots that apparently now they make coatings that you can lower the temperature of them by about 40 degrees if you coat them with a more reflective white surface. So some interesting ideas that hopefully we could follow up on, and then others that come out of this. Appreciate your work. Thank you.
Councilmember Cano.
Yeah, I don't know if this is a question for you or maybe for Kelly, but going back to the map that identified the areas of the city where these kinds of issues would be most prominent, is that similar data that's being used for the green zones work group, or is this a different set of metrics that are being used to identify these areas?
Yes, Chair, Councilman Cano, that is correct. A number of these indicators will also be used for the Green Zones project.
I thought of that also, that there might be a lot of some overlap here with this data, and I appreciate that. And in terms of how hot it gets in the summers, and this summer, one of the things that I was hearing about was some of the parks that were going to close because it was so hot, and some of those were in neighborhoods where there probably wasn't much central air conditioning, and it was interesting. What are we going to do so that we make sure there are places for people to go to, especially more vulnerable individuals, to cool off? And that. So, of course, all this data is good and the community engagement process is good, but as policymakers up here, we're waiting to see what are the levers you're going to identify for us to try to get done so that we can address some of these. And that makes me think of how will this inform the green zones work. But we also, I think all of us here are aware of a large grant that we got recently for a resiliency office, which is, we're not quite sure what that is. But here's an opportunity maybe for us to help focus it in, and hopefully this will be timed well as that's kind of looking at priorities of what they can do. We have some of this, I think, clearly addressing climate change and its impacts could fit well under that larger umbrella of what I think it's the Rockefeller Foundation was defining as resilient communities. So I just wanted to put that out there. I don't see any other questions up here. So if you don't have any other comments, thank you so much. And we'll look forward to hearing more and I think participating in some of those community dialogues if we're invited. And hopefully we will be. Don't forget, council members, when you start communicating those dates and those locations. So I will move to receive and file the presentation. Seeing no discussion, all those in favor say aye.
Aye.
Any opposed say no. That motion carries then. And I believe we have concluded with all our business. And so this meeting is adjourned. Thank you.